Supreme Court has decided the abortion pill is staying on the market. A ruling today allows doctors to prescribe the pill and mail it to patients without an in-person visit. I'm Erin Christie. We are glad you're watching 2 News at 5 tonight. The drug is called Mifepristone. It is our top story tonight. This morning, the Supreme Court rejected a lawsuit challenging the FDA's approach to regulating the drug. Justice Brett Kavanaugh wrote the unanimous opinion. He said doctors and anti-abortion groups didn't have standing to sue. Abortion, also a huge point of contention here in Oklahoma. Governor Kevin Stitt has called the Sooner State the most pro-life state in the nation. So tonight, 2 News Oklahoma's Braden Bates goes in depth on the ruling and what it means here in Oklahoma.
And we want to see abortion abolished. We don't see any situation that would allow for an abortion.
And we need full access back in our state. It is not right, again, that our neighboring states have more rights than Oklahomans.
With the U.S. Supreme Court deciding to allow the use of the abortion pill Mifepristone, many Oklahomans questioned what this means moving forward. On Thursday, I reached out to the Oklahoma Call for Reproductive Justice and Abolish Abortion Oklahoma. Tamaya Cox-Torre is the chair for the OCRJ. She says limiting and banning abortions is not a solution.
And what we knew is that even banning abortion access doesn't ban abortions, doesn't stop abortions. People are finding means to get the care that they need. And a lot of ways that this is causing people to travel out of state or access abortion pills through mail.
Meanwhile, Bill Askell with Abolish Abortion Oklahoma tells me there's another way.
So what I would say to a woman in a problem pregnancy is, let us come along beside you. Let us help you, nurture you, support you, protect you, bring this child to term where you won't have the hangover of regret when one day you realize you've murdered your own child.
I'm told that in some circumstances, people could have access to Mifepristone if they use a telehealth service. That's where they would meet with their out-of-state provider, who would then be able to call in and mail that prescription to their door. Due to Oklahoma's abortion laws, Cox-Torre says this isn't a viable option for everyone. Askell says these drugs are harmful.
Now, it's happening at home all the time. Easily 2/3 or better of the abortions being performed now are happening at home. And they're not happening by a doctor. A woman is taking the life of her child. So we've got to have a culture of life, I think, is what needs to happen in Oklahoma.
However, Cox-Torre disagrees.
We know that there are extreme organizations out there finding ways to get rid of Mifepristone, which is a medicine used by over 6 million Americans. It is the gold standard when it comes to ending the pregnancy.
Askell says he hopes they can pass more, while Cox-Torre says she's ready to challenge them more. In Tulsa, Braden Bates, 2 News, Oklahoma.
In Oklahoma, abortion is illegal in almost all circumstances, one exception, to save the mother's life.